name is Sara Munera. Thank you, Kritika. My name is Sara Munera, and I am the technical coordinator for ISWP. I am from Colombia and work as a physical therapist and as an ISWP recognized trainer at both basic and intermediate level. I am also an assistive technology professional and a wheelchair service provider, and it is my pleasure to be here with you today. Thank you so much for joining one more time. We want to know who you are, and we know that already we have people from Cameroon, we have people from Laos, we have people from Somalia, so welcome everyone. And we are going to launch a poll asking you if you are a physical therapist, an occupational therapist, prosthetic and orthotist, PM&R physician, nurse, social worker, researcher, instructor, or other, just so we know who is in this call. And I can see that you are already voting. Thank you so much. Great, so we will give another 2 seconds for those who have not voted yet. Thank you all, and I will end the poll and share the results with you. So we have mainly physiotherapists in this call. How interesting, 30% of us are physiotherapists. We have some occupational therapists, 23%. We have 13% of prosthetic and orthotics. That's amazing. We have 1 PM&R physician and 1 nurse. It is great to be with you all. And we have 2 researchers as well, and 6 people that are other. So thank you all for joining. As Mary mentioned, we want to remind you that this is the first webinar that we are having on this training series. So make sure that you are scheduled for our upcoming webinars as well. And you can write in the chat now or at any time what other training or topics you would like us to talk about during these webinars. And we will make sure to have those in upcoming webinars. We also have, as Mary mentioned, 3 webinars in Spanish, so you can visit our website and get those dates. So I want to share this reminder on how Zoom works. In the bottom part of your screen, you will see a black line in which you can mute and unmute yourself and start and stop your video. And we will ask you to keep your microphone muted at all times unless you want to talk. So we can hear everyone clearly. And you can also see the list of participants and the chat. Now I'm going to ask you to go to the list of participants and find your name there. It should be the first one. You're going to click more, and then you're going to rename yourself. You're going to add your name and your country. So for example, I will name myself as Sara from Colombia. So let's all do it now, so we can see where are we from in this call. So I see Danica from the Philippines, welcome. Donna from World Education from Laos, welcome Donna. Edward from Colombia. Leonard for Philippines. This is great that we are already 52 participants, so we're going to give 2 more seconds so everyone can rename themselves and we can know where we are in the world. Welcome Osiris from Colombia, Norma from Mexico. Lily from Singapore, Kimberly from Ireland, Joe from Mozambique. It's super interesting to see people from around the globe with us today. So thank you so much for sharing who you are and where you are. To use the chat, you can open it by clicking on the chat button and make sure you are sending your message to everyone instead of just to someone else. And you can also choose to send a message directly to Critica Candival if you need any technical support at any time during this call. Now let's make sure you're typing to everyone, and please let us know what time is it where you are. So let's see in the chat how early or how late it is for some of you. 5 p.m. from Donna, 3:30 in India, 6 a.m. in Canada, 3 a.m. in California. Oh my gosh, it is 5 a.m. for me, and I thought I was early. So thank you for joining us at 3 a.m. your time. We have noon, 7 a.m., 5 a.m. as well, 11 a.m., 3:30 in India, 1 in Turkey. This is amazing. Thank you all so much for joining us. So let's begin. By the end of this webinar, you will be able to understand what an appropriate wheelchair is, name the World Health Organization 8 steps for wheelchair service provision, and understand the systems thinking approach to improve wheelchair services. And these two first elements can be a summary or a recap for some of you, but the third one can be a new concept for many learners, and we are super excited to share this with you all. We also want to remember you that we are part of a large community from around the world and that it is always growing. So we encourage you to share on social media your participation in this webinar. You can take pictures of your screen, tag us with @ISWP.org, and you can use the hashtags Ability Meets Mobility and ISWP Webinars. You have it on the screen, and we will be engaging with you through social media and sharing your posts. Now, we want to know if you are already part of the International Society of Wheelchair Professionals. So we will share with you another poll asking you if you are part of our community or not yet. Already we have 60% of people that already voted. For those who haven't yet, please go ahead and do so. We will give another 2 minutes. Okay, and I will end the poll now and share the results with you. So half of you already knew the International Society of Wheelchair Professionals and half of you didn't. So welcome to all of our new people that is joining today. If you are new, you can send a private message to Critica and she will add you to our distribution list. So for those who are not familiar with ISWP, I just want to recall our mission, our vision. Our mission is to serve as a global resource for wheelchair services, standards, and provision through advocacy, education, standards, evidence-based practice, innovation, and to be a platform for innovation exchange. We aim that all people who need wheeled mobility devices receive the appropriate products and services with dignity, enabling to access employment, healthcare, and to participate in their communities. You can join our community, as I just mentioned, either sending your email to Critica on a private message or joining our website, and Critica is going to share that link on the chat as well. So you can just click and join us. We would now like to learn who in this webinar is an ISWP certified wheelchair service provider. And being a certified provider is important because it makes us aware of a need to standardize our practice. It proves that you are competent to deliver manual wheelchair services, which is really important if you're working in this field. It shows your commitment to work with professional and ethical standards and reaffirms your commitment to update your knowledge of basic wheelchair service provision. So we will give 2 more seconds for those who have not voted yet. Sorry. And I will end the poll now and share the results with you. So 8 of you are certified wheelchair service providers. That's amazing, and the majority of you are not. So if you're not, don't worry. We want to invite you to get your certification, and we will give a discount code by the end of this webinar so you can do so you can become a certified wheelchair service provider. The process is very simple. You just have to pass the ISWP Wheelchair Service Provision Basic Test, complete an online training module in ethics and professionalism, and then pass a test relating to that information, and then share your supporting documents and make the payment according to the fees in your country. And for the 8 of you who, sorry, go ahead.
I just clicking as yes, but I wasn't sure. I only took the basic test, so I thought that was the one. But I didn't do the online test, so you can minus me. So I'm not fully certified at this. Yeah.
Okay, so we welcome you to get fully certified, and if you want to, you can write your email privately to Kritika, and she will send you the information on how to do so. So if you already took the ISWP Wheelchair Service Provision Basic Test, that's the first step, and you have that, amazing. And now there are some other tests that you can do if you want to get certified. Thank you. And for those of you who are certified providers, that is amazing. We also have great news for you in this webinar. We will count this as continuing education, so remember to add it to your self-study form during the recertification application. And I see on the chat that Edward is on the process, so that's amazing, thank you. Now let's begin by understanding why appropriate wheelchairs are important. And as I mentioned, this may be a recap for some of you, but it's so fundamental for all of us to understand this that I think it's important to say it one and over again, just so we are clear on how big of a deal appropriate wheelchair services are. In the world, 75 million people are in need of a wheelchair. And without proper mobility, they will be unable to perform daily activities such as moving around, going to school, going to work, and doing all other activities that they want to. Access to personal mobility is a human right, according to the United Conventions on the Rights of Persons with Disabilities. But unfortunately, approximately 85% of those needing a wheelchair cannot access one. Do you know how many wheelchair users are in your country? So you can calculate it by the 1% of your country's population. So for those of you who know it, you can put it in the chat so we can see the magnitude around the world. And for those of you who don't know it, we can make this simple calculation. So in Colombia, for example, we are around 50 million people. So the number of people needing a wheelchair should be around 500,000. So we will give a few seconds for those of you who know how many people in your country needs appropriate wheelchairs. And based on the amount of people that need appropriate wheelchairs, then we will need to have wheelchairs for that demand, and we'll also need to have certified wheelchair service provider. Thank you, Margie. I see you have added your comment there in the chat. Thank you, Omar. Thank you, Donna. Great. So when we talk about a product, when we talk about appropriate wheelchairs, what we mean is a wheelchair that meets the user's needs and the environmental conditions, that provides proper fit and postural support, that is safe and durable, that is available in the country and can be obtained and maintained, and services can be sustained in that country at the most economical and affordable price. So based on this information and this definition from the World Health Organization, not all wheelchairs are appropriate. We need to make sure wheelchairs relate to this definition in order for them to be appropriate. But users need way more than a product. And this is where the word assistive technology, or AT, is important. AT is an umbrella term covering the systems and services related to the delivery of assistive technology. So the glasses that I'm wearing, for example, by itself are not AT, they are just a product. When someone has the knowledge about glasses that can make an evaluation of my needs and prescribe them to me, and then where there are services established allowing me to access to these glasses, then they become assistive technology. So as you can see, we not only need products, but we also need all this service delivery system and these professionals that are well trained in order to provide appropriate wheelchairs. So when we talk about wheelchair service provision, what we are referring to is to all necessary steps to ensure a user will receive the wheelchair he or she needs to fulfill the right of personal mobility and every other human rights. If a person cannot access an appropriate wheelchair, then they cannot go to school, they cannot go to work or engage in any other activities they want to. And I'm pretty sure you all know that according to the World Health Organization, we have 8 steps to ensure this wheelchair provision service. It starts with someone recognizing that you need an appropriate wheelchair and referring you to a specific place where a wheelchair service provider can make an assessment and a prescription, which are the steps 2 and 3. Then you will need to find how to fund and order your wheelchair, and then the product will be prepared for you according to that assessment and that prescription. Then you will go to a wheelchair service provider to do the fitting, train on how you can use your wheelchair and how to perform maintenance, and then some follow-up appointments will be done to ensure the wheelchair is functioning properly. Now we would like to know which of these steps you are involved in. So we will launch a poll and you can again answer, and I will give a little bit more time and mute myself while you. Let's wait a little bit more for those who are still in the process of voting. And I can see now that many of us work on all 8 steps. Perfect. I will end the poll now and share the results with you. So most of the people in this call is involved in user training. And after that, I think it will be assessment, prescription, appointment and referral, product preparation, fitting, and maintenance, repairs, and follow-ups. So we are all working in different steps. Maybe some are just working in 1 or 2 steps, or maybe some are working in all these steps. But as we mentioned, it is important to understand this big need that you have been sharing with us in the chat. Once we understand that need, we understand what an appropriate product is, and we understand that the product by itself will not fulfill the right to personal mobility. We need trained professionals, and we would need a system to deliver that, which is assistive technology. Please remember to share your comments and questions in the chat. We will be putting them together and make sure we will have time at the end of this webinar or of this call to talk a little bit more about your comments and answer some questions. So if we understand what a product is, what an assistive technology is, and why it is important to have certified wheelchair service providers, thanks to this step, we need then to have a more systemic approach in order to ensure the right wheelchair service provision. We need to think about the people that is receiving this wheelchair, about policies, about products, provision, personnel, and so on. So people or the user are of course the center of this process. They know what they need and they have a specific context that is important in order to recommend an appropriate wheelchair. When we talk about policy, it is important to remember that very few countries have a national assistive technology policy or program. In many countries, access to assistive technology in the public sector is poor or non-existent. Even in high-income countries, assistive products are often rationed or not included within the health and welfare schemes, leading to high out-of-pocket payment by users and their families. For example, it is a common policy in a number of European countries for the state to provide older adults with only one hearing aid, despite the fact that most people with age-related hearing loss require 2 hearing aids to function. So to think about the policy and how it relates to this whole systems is important. And if you want to share some comments about your country and if wheelchairs are part or not of the healthcare or welfare schemes, we welcome your comments in the chat. Regarding products, the industry is currently limited and specialized, primarily serving high-income markets. There is a lack of state funding, nationwide service delivery system, user-centered research and development, procurement systems, quality and safety standard, and context-appropriate product design. One arrow ahead, sorry. In terms of provision, in high-income countries, services are often standalone and are not integrated. So people are forced to attend to multiple appointments at different locations, which are costly and add to the burden on the user as well as the caregivers and on the health and welfare budgets. In many low and middle income countries, national service delivery for assistive products does not exist. Those who can afford these products go and buy them directly from a pharmacy, private clinic, or workshop, and people from the poorer sector of society must rely on donations or charity services, which often focus on delivering large quantity of low quality or used products. These are often not appropriate for the user or the context and lack mechanisms of repair and follow-up, and a similar scenario is also common in emergency responses programs. So once again, if you want to share how the provision system works in your country, please go ahead and do so in the chat. In terms of personnel, the trained health personnel is essential for the proper prescription, fitting, user training, and follow-up of assistive products. With these key steps, assistive products are often of no benefit or abandoned, and they may even cause physical harm, as in the case of providing wheelchairs without a pressure relief cushion for people with a spinal cord injury. So as we have seen, there are some key elements for wheelchair service provision, and the World Health Organization and the strategy 80-20-30 is encouraging all stakeholders to act together in leadership and governance. So there is one organization in charge of the regulation of wheelchair services in the country, to work in funding so assistive products are part of the healthcare system, to work in labor force so each country can have trained professionals, in services so products are appropriate for the context, and in information systems to have better data to understand the user's needs and to inform the system. And we have a comment here in the chat, which is amazing. Thank you so much, Joao. In Mozambique, the provision is based on the charity model. A few funded by the government and most by charity organizations. And yes, they are inadequate, low quality wheelchairs. Thank you so much. Thank you so much for that comment. And as we mentioned, this may be the case for a lot of countries. So this is why it is fundamental to understand this systemic approach to see what are all these pieces coming together in the service wheelchair provision model. And as you can see, we have not mentioned this, but as you can see, there are other layers in this circle. For example, the procurement. So for those, for the government, for example, what is the procurement process in order to access wheelchair? How do they know if the wheelchairs that they are buying are appropriate for their needs? In terms of promotion, it will be how we talk about wheelchairs. If we are still in a charitative model, or if we talk about wheelchairs as someone that will enable people to do different activities. In terms of pace, which is behind this arrow, is the rhythm of implementation of policies and different legislations in one specific country. In terms of place, this relates to the different areas on a country or the different contexts. It will be different, for example, to provide a wheelchair in a big city that provide that in the rural area or in the countryside. And partnership, it's all the stakeholders that are involved and that should work together in order to provide all this appropriate wheelchair service provision. So once again, if anyone wants to comment, please go ahead and do it on the chat, or you can unmute your microphone and share a little bit about how this systems thinking approach works in your country. I will give just a few seconds in case some of you want to share. Thank you, Donna. In Laos, it is a combination of external support, DIC providing flat-backed wheelchairs to be constructed, and some local construction via central government workshop. Also, users can buy basic wheelchairs from private pharmacies. Super interesting. Thank you, Donna. And I wonder if those private pharmacies have certified wheelchair service providers or trained professionals, so you can have an evaluation, right? Because as we have seen previously on the 8 steps, the purchasing process is just one of the 8 steps. It doesn't matter where the money comes from. It doesn't matter if it's from a charity organization, if it is from out of pocket, or if it is given by the government. But the important thing is that that is only one step. We also need to make sure people will have an evaluation, a prescription, then that someone will train that user on how to use the wheelchair and so on. We have another comment from someone in Somalia. We receive motivation wheelchairs through ICRC and give to the user almost free of charge. Great, this is amazing. And as I just mentioned, this, like, we are talking right now about who is the payer, but we need to remember that no matter who the payer is, we need to think of all the steps in wheelchair service provision, as well as in this systems thinking approach. In Cameroon, the wheelchair is provided by the specific organization and mostly the non-profit organization and non-governmental organization, which most of the wheelchairs are inadequate. We have another comment from someone in Cameroon. There is no governmental policy. The provision is based on charity model, and most of the time wheelchairs are not appropriate. Real need to raise awareness on that, definitely. And this is all like a call to action, right? We are not sharing this in the chat to see how difficult it is, but to see that we have a challenge that we need to overcome. And we need to have this systems thinking approach and sharing this information with the government, sharing this information with different organizations, being aware of our need of getting more information and studying more and being like working all the time towards this. And let me see what else we have in the chat. Thank you so much for all your comments, and Donna answered my question regarding the training and evaluations and so on when you buy on the pharmacy. So there is no regulations nor training for pharmacy staff. So you can start an education program for pharmacy staff, Donna. From CRP, we produce and deliver 25 number of basic level wheelchairs and between 20 to 25 number of intermediate level wheelchairs per month. That is amazing. So we also have some products that are not only imported, but that are also built locally according to the needs of that population. That's amazing. Our project is supporting Ministry of Health to develop AP policy and regulations so donors can coordinate their approach. That is great because donors are really important. They're the way to get wheelchairs in a lot of countries. We just need to support them to make right it is done on an appropriate way. In Mozambique, wheelchairs sold in private pharmacies, and if someone wants to unmute their microphone, so you are just not hearing my beautiful voice with my lovely Colombian accent, please feel free to do so. In Mozambique, wheelchairs sold in private pharmacies are essentially those used in hospitals. This is inadequate for being used outside in the community. Many charity organizations ship wheelchairs from the original countries. Funding is mostly by international organizations. In Cameroon, also, they paid for the wheelchairs. Barbara shares some concern about charity organizations that provide basic wheelchairs without trained therapist suppliers involved. That is a concern we all share, Barbara. And as I mentioned, these stakeholders are important, but we need to support them and make sure this is done in an appropriate way. In Yemen, we receive motivation wheelchairs through ICRC. So ICRC is supporting a lot of countries around the globe and give it to a user free of charge, but there is no awareness about information. So most wheelchairs are delivered without assessment. Paraplegic Center provided 600, I think, I'm really bad for numbers, apologize, wheelchairs to people with a spinal cord injury through funding from government. That is great, Mansour, thank you so much for sharing. And monitoring and supervision sometimes needed for CRP production in Bangladesh particularly. This is amazing. Thank you so much for sharing all your comments. And it is super important for all of us to understand how wheelchair provision is working in different parts of the world, because it can be a way of better understanding this and also getting some inspiration so we can make sure to do our work and our assessments in an appropriate way. Thank you all. So we will finish this webinar by sharing one case study of a country that is moving forward in wheelchair service provision, Dominican Republic. And as I just mentioned, this is inspiration for all of you to keep working, to keep doing different things in order to ensure that appropriate wheelchairs are being delivered in your context. So in 2019, a new policy was created in Dominican Republic to include manual wheelchairs in the list of products that were funded by the health system. So of course, they found a lot of challenges with that new policy, such as the insufficient wheelchair service personnel, the lack of wheelchair services, the lack of wheelchair product quality standards, and the lack of procurement systems. So during 2020, ISWP basic hybrid training was done in Spanish, and 39 professionals were certified as wheelchair service providers. And then in early 2021, an ISWP hybrid training of trainers was done. So this time, professionals become trainers. So, Kritika, you can help me muting. And if you didn't unmute yourself by chance, but because you want to talk, please feel free to do so. I just want to make sure. So as I mentioned, then a training of trainers was done in order to these professionals being able to train more people in their context with their new skills. And they were also added as trainers in training in our website map. With these new trained personnel, services can be better established and improved. And they have been advocating to have better products and better standards for those products. So as we have talked, this knowledge that we are gaining every day with the information that we read, with webinars as this one, with our users and the people we work with, is super important, because the more trained we are, the more we are able to advocate in different parts of this systems thinking approach in order to make sure users will get appropriate wheelchairs. I want to look at another comment that we have in the chat. I will investigate our policies in Mozambique regarding this matter. Great, that's an amazing job, thank you. So remember that by each dollar that your country spends on assistive technology provision, it will have a return on investment of $9. And this is amazing, this is big, this is a document that was released last year. And that return of investment can be seen in active education and recreation for children, in employment for adults, and in active participation of people with disabilities in all activities. So in this webinar, we did a summary of what assistive technology is, the services in wheelchair provision, the importance of having a systemic approach to this topic, and we hope you can read this really interesting document about the importance of investing in assistive technology. So Kritika is going to share with you the link to this document on the chat. And we would like to keep this conversation going on social media. So feel free to look at the document and share your thoughts and your comments with us through social media, and we will make sure to answer you on that way. And we have some more time available. We wanted to make sure we had this additional time for questions and for comments from you all. So we will open our webinar at this time. I'm just looking at the chat. Please come to Bangladesh for providing advocacy on why we need to have policy and how it will reflect regarding this. Thank you so much for the invitation. We will definitely go. And it is super important that you already have this information with the document that we just shared. We will share on the chat. It is super important that you can also become advocates within your context, because the needs that we all have in the world are different. Even in one same country, in different places, we may have different needs. So definitely make sure to reach out to us if you need any support, but to become an advocate for the changes you need to see in your context. I don't know if we have any other comments. We have a question if it's possible to have the PowerPoint presentation. We will share it, and we will also share the recording of this session and all the links that we have sent throughout, so you will have it. I'm not sure if Mary, Nancy, or Kritika want to share anything else before we go. Barbara has a comment here. I'm very excited about this webinar and the sharing of advocacy needed around the world. Keliwa introduced me to the ISWP, and I look forward to becoming certified and providing guidance to others. Yay, bye, Barbara. That's amazing. Thank you so much.
Sarah, I would just thank everyone again for joining, and perhaps we could just put into the chat the next dates again as a reminder for the future webinars. And we encourage everyone to bring a friend to the next one. The power of our virtual Zoom is that we're just all an invite away. So again, Sarah, we so appreciate your time here today, and so excited to see our network grow. I think I only recognized a couple of names on here. So please bring a friend next time, and thank you again.
That's a great invitation. Thank you, Mary. So thank you all for your commitment to improve your knowledge and to be a great wheelchair provider. The discount code for those of you interested in becoming certified wheelchair service providers is ISWP Web 1. You have it on your screen, ISWP WEB 1. And as a reminder, you can contact Kritika for more information or visit our website if you want to have more information about us and join our community. Kritika just shared the link to the certification process in the chat. Thank you very much. And we also wanted to share that there are many opportunities to keep learning. We want to invite you to join us to the International Setting Symposium in October this year in Pittsburgh, US. It can be either online or in person, and to the WFOT Congress and Oceania Setting Symposium. So make sure you are aware of all of these interesting opportunities. We hope to see you in our next webinar in English that will be on July the 2nd. And for Spanish speakers, we will repeat this webinar in Spanish on Wednesday, May 19 at 11 Eastern. So as Mary mentioned, please join with a friend next time. Share this invite to our second webinar in which we will be talking about user evaluation and wheelchair prescription. And if you have a colleague that is a Spanish speaker, please let them know that we will also have this in Spanish. And please remember to follow us on social media. We invite you to post one thing you learned on this webinar or one thing you would like to learn more about. Thank you all.